deal with enrolling new providers, helping them out along the enrollment journey. I also help write like habilitation programs with providers, billing, if there's any type of billing needs that they need, how to bill, the electronic visit verifications, which we'll kind of touch on just a little bit tonight in my presentation, has been since January of 2020. So we've had some hiccups along the way, but I do think it is working very well now. So yeah, so if anybody, I just kind of help out with any provider needs. And then as well, I help the service coordinators out with any of their needs with our DD and AD waivers. So go ahead and go to the next slide if you would, please. Or if I can do it. Okay, so we'll just go over just a little bit of general information for our AD and DD waiver services. We'll talk a little bit about independent provider requirements, and then kind of how our referral process goes. Just a little bit, I'll touch on that. Not too much, only because when they get in, I do give an independent provider training to them, so they have a little bit more in-depth information. So sorry, that's my daughter. She's sneaking up behind me. Okay, next slide, please. There we go. Okay, so Medicaid does provide our funds. Some of our funds, we do have matching. So basically, if we didn't have that federal match from Medicaid, we wouldn't be able to provide services to as many participants as we do. There's about 4,800 individuals statewide that do receive on the DD waiver currently. And like I said, if federal funding wasn't available, we'd have about less than half of that amount of money to provide services to the same amount of people. We do require that all AD and DD providers register as Medicaid providers. And so they use it's called Maximus, and it's actually through Medicaid. It's their provider enrollment system. And so we just require them to be thoroughly familiar with any of the provider requirements. They do sign an MC-19, which is a provider agreement that kind of requires about 15 things. And then of course, they do need to be in compliance with our regulations, any policies and procedures. And then I do have a Code of Federal Regulations. That's what the CFR is listed down there. And that just agrees that, the provider just agrees to permit CMS to kind of come in and do inspections, or service coordinators to come in at any time and kind of just make sure everything is on the up and up, and the participants are being cared for in the highest manner possible. Okay. Next slide. So I just kind of wanted to highlight a couple of things. Sometimes I get this question a lot. Well, what's the difference between agency and independent providers? Those agencies are going to be your big providers. They're going to be the ones who have that. They have to be certified by public health, and they take on that administrative responsibility, such as they hire the staff, they dismiss the staff, any training, scheduling, they make sure all their staff have those required education, experience, any other requirements that we ask of them. And then we also have the independent providers, and those are going to be the ones that are hired by the family or hired by the guardian and the participant. The participant and the guardian are going to be the ones that are responsible for all those things. Scheduling, just directing their own services, self-direction. So independent providers are not employees of the state of Nebraska. This question comes up a lot also. They're considered an independent contractor. They are hired again by the participant or their guardian, and they can also provide services to either one participant or several. I know with the DSP shortage in Nebraska and all over the place, I've gotten a lot of referrals for independent providers, because, you know, a lot of times it's someone they know and they feel more comfortable with, instead of someone just maybe off the street. We don't place participants with independent providers. So they're kind of, if they don't have a participant in mind, they are kind of responsible for marketing, you know, their availability and skills to everybody. They are also responsible for paying their own taxes. They get 1099 payments at the end of the year. There's just only 2 that are listed there that are W-2 taxable income. Okay, next slide. So I kind of touched on a little bit of independent provider requirements on those MC-19s. We do have a couple of them, so I'll talk just a skosh. I'm going to touch on EVV, or electronic visit verification. Like I said, it was part of the 21st Century Cures Act. It was passed by Congress, and it does require some of our services to use that EVV. It was put in place to really reduce that fraud, waste, and abuse, and just ensure that those in-home services are being, you know, they're there and they are providing those services. There's 2 different apps or modules that are used. It would be in conjunction with our TheraP system, and then is also our NetSmart system. So I do have links throughout this presentation. I don't know if Jennifer, you're going to send this out afterwards, but if you're curious about how the EVV system works, there's links throughout here as well. And then the next slide's just going to be some, these are just all of our services that do require that EVV service. So I've added both DD and AD, aged and disabled waiver services, on here. So we'll talk a little bit about independent provider requirements on the next slide. These are for DD. So they do need that driver's license or that, you know, personal identification. For our habilitative services, we do require either a bachelor's degree in a human services field, or for a more experience, like either professionally in life. It can also be a combination of education and experience, just as long as it totals that 4 years or 48 months. We do ask for, you know, a copy of the transcripts if they are using that education part to become a provider. We will ask for that to be uploaded. They also have to have, you can go to the next slide, please. They also have to have abuse and neglect and exploitation, and follow that state law reporting requirements. When they do turn in their referral form, I will send them an attachment about independent provider requirements, so they are aware of what they need to do. For that CPR, we do require that it is in person, or could be half and half. So as long as they do that hands-on skill evaluation, that's the most important part that they need to have. The first aid, it can be online. And like I kind of mentioned, we do have that habilitation program writing, as well as TheraP has a great training academy that they can go on to and just kind of get some training through there. Of course, they can always call me also if they need any assistance, and I can help them with that too.
Okay, we've had a question come in.
Sure.
Yep. You got it.
Are these requirements that you are going over, are those federally required, or are others state required?
They're state required. They're in our regulations and in our waivers.
And then I have another question. Someone was wondering if there's anywhere that you can find independent providers listed.
So I am currently in the process of coming up with a map that is an interactive map that will have, if you click on Lincoln, it will pull up all of the providers available in the city of Lincoln, both AD and DD. We do ask on the referral form if they are interested in being on a list, just up until now, we didn't really have a list, to be frank. So yes, we are in the process of doing a map, an interactive map that we can get these names out there for everybody so they'll be able to see them. So the
Awesome,
AD,
thank you.
so the AD providers don't quite have as many requirements as the DD ones do. They are required to have their central registry checks. DD is as well on themselves, as well as the family members, if they have any, if they're going to be providing any services in their home. And then they do have to do fingerprinting. So that's a little bit different than DD. AD requires fingerprinting and DD does not. So you're interested, you have an independent provider. Well, how in the world do you get them to work with you? So basically, the participant or the guardian will talk with their service coordinator. And then they will, say, hey, I want to work with this person. The most important thing that I always tell independent providers, and really anybody when I talk to them, is the participant is the one who's going to choose that person to be hired. It is person-centered, it is self-directed. The participant really needs to be the one to choose that person. The service coordinator will discuss the services and supports they have that they've talked about, that's laid out in their individual support plan with that potential independent provider. There's 2 pages to the Medicaid enrollment form. The first page is going to be the independent provider information, and that second page is going to be for the service coordinator to fill out. They'll send it in to me, and then I will, you can go ahead and go to the next page. I will go ahead and send that form and get it started in the Medicaid enrollment process. I just have the email listed there for where to send in the emails. And this is for the DD process. The independent provider, or the AD process is coming up next. They're not much different, except for the fact that you can go to the next slide, please. The AD providers, they do go through like the league and the AAAs and stuff like that. So they will get a list of the current approved providers and also an enrollment packet for them. If the participant does have a provider in mind, they'll just give the applicant the packet and have them complete the forms and then return those to the service coordinator. Once they are approved, on both waivers, actually, Maximus will send them a welcome email, and then they'll be on the AD side, they will be assigned to an MLTC RD worker. The DD workers, the DD independent providers are assigned to me. And then the RD will have 3 business days to set up that face-to-face meeting, go over final paperwork, the SNA, and then also review the EVV with them.
So we do have one question. How long does the process take for an independent provider to get approved, trained, before they're actually actively being reimbursed?
Sure, that's a great question. So it really takes as long as it takes. I know so let me explain just a little bit. So as soon as that referral gets into Maximus, if the independent provider really gets in there, if they upload their CPR, their first aid, their abuse neglect, their driver's license, if they answer all the questions they have in their bank account information. I mean, I've had providers approved within a couple of days. If they don't get in there and really kind of stay on the ball and do things, it can take months. It just kind of depends on how fast they really get in there and do that. As far as training, we don't require them to take the independent provider trainings that I do give, but it is a good idea. They don't have to be trained in those before they can start working. As soon as they're approved, they can start working and start billing for the time that they are providing.
Okay, thank you.
Mm-hmm.
And
So
as far as the application fee, was that the same for both the A&D and the DD?
So yeah, it was a $5. I think it's just for the background check.
Okay.
I think it's like $250 plus two, so it's like $5, I believe is the fee. So piggybacking on, and if you want to go to the next slide, we can kind of talk, I added this one in there, just a little bit about payment. I get these questions every once in a while. So the independent providers are covered under the Prompt Payment Act in Nebraska. And so they're kind of, I laid out just a little bit what they can and they can't bill for. A lot of times they would like to bill for mileage, but sometimes it is included in that service definition or that rate. So they can't bill for mileage on top of billing for that rate. There's also sometimes that, you know, they have to go to meetings or they have to do their CPR training and first aid. Those are already included in those rates that they are paid. So they can't bill on top of that. So they're just, it's basically other duties as assigned. You know, spending any time with the family or the service coordinator about the services when they do their documenting on the, you know, if it's the rehabilitation program or if they're billing, if they have to go to any ISP meetings, just stuff like that. Those are already included in their rates, so they don't get anything higher than what they're being paid. On the next page, I do have if anybody is interested, I do have the link to the current pay structure, because we do have maximum rates for each service that they can be paid. There is room for negotiation to go down if possible, you know, if the participant maybe doesn't have enough in their budget, and so they wouldn't be able to buy the service at the rate that it is, the maximum rate for that service.
We've had another question come in. Do you happen to know what the range of pay is for the independent service providers?
I know the highest goes up to 27 something an hour for our community integration. I believe the lowest is our respite rates. I think they're around 13 something an hour.
Also, a follow-up to that, do you happen to know how many independent service providers we have currently? And has there been, has that decreased since COVID?
We currently have 645 or 46 on the developmental disabilities independent providers, and we have around 900 on the aged and disabled. And I've only seen it go up from there. I mean, at least the ones who are applying for the independent provider services, and the numbers that I have quoted were currently still active, billing and providing those services. So that's all I have. I know it's kind of short and sweet, but I figured if there are any questions that you can think of that doesn't pertain to stuff in my PowerPoint, absolutely ask. It's great that everybody joined tonight.
We did have another question come in. Are parents or guardians able to be independent service providers?
So on the aged and disabled waiver, yes. On the developmental disabled waiver, no.
And is that of minors and adults or just for adult children?
Both. So basically, if anybody's legally responsible on the DD waiver, they're not able to become a provider. On the AD waiver, they are.
But it could be another family member on the DD one.
Yes.
Okay.
Yes, as long as they're not a guardian or obviously like a spouse or something like that, as long as they're not legally responsible, yes.
Okay.
Do you have any other questions, Whitney? I don't have any coming in right now.
I don't have any more either. Oh, wait, I got one. It's kind of what we were just talking about. If they are a parent but not listed guardian, could they be a provider?
Of an adult, yes.
Yes. Okay.
Obviously, yes.
Yes. Okay, perfect.
Mhm.
And then I got two more now. We're getting more in now.
Keep them coming.
How often do independent service providers have to recertify their CPR and the criminal background check, the abuse, neglect, all the things that are mandatory to originally become one?
Sure. Most of the CPR, they are required to be renewed every 2 years. So it just kind of depends on what CPR class they did take and what it says on their card for the expiration date. Maximus does require an annual review where they will do another criminal background check, as well as, they'll check their CPR and make sure it's still valid, their driver's license, or any other certifications they may have uploaded into their account. That's done annually. They have to go through a full review every 5 years. And I'm not exactly sure what that all entails. Maximus just kind of takes that on, but I'm assuming it's kind of the same deal with everything.
Okay, thank you. Our next one is, and I don't know if you're familiar with this, can parents be providers if they are on the Katie Beckett waiver?
I'm not sure about the Katie Beckett waiver.
Okay.
That's out of, I have heard of the Katie Beckett waiver, but that's a little out of my scope of knowledge.
Okay. And then our next one is going to be, how often are they paid for services?
So the independent providers, we do prefer that they bill for services on a weekly basis. But I mean, they can bill daily. The EVV will, if they're doing EVV services, if they put their billing in by Sunday at midnight, they will be paid that next Friday. So about a week's worth of time. If they do the services that aren't enrolled in EVV, they'll get about 3 to 5 days for payment once they bill.
Okay. And then if someone wants to become a DSP for a specific person, not an organization, what would be their first steps?
Contact the service coordinator. That would be, that'd be the first step.
Can independent providers watch a bill for 2 clients at the same time? Or can they only provide service for one person at a time? So can they have multiple people that they're independent providers for?
Mm-hmm. So it depends on a few things with that. We do have group rates with some of our services. So you'd build the group rate. If you're doing the same thing like community inclusion or something like that, then yes, you could, depending on the participant, like their supervision levels or kind of what their level of, if you're able to watch, or to provide services to 2 of them at the same time or 3 of them at the same time, it just kind of depends. But yeah, we have independent providers that take people, take them and their friends out to a movie or, something like that. It's a person by person basis, but yes, we can.
Okay, thank you. So, and then this one, we kind of talked about it a little bit earlier, but Douglas County only allows one guardian. And if the mom is a guardian and the dad is a standby, he can be the independent provider, correct?
Yes, as long as he's not that legal guardian, yes.
Okay. And then someone wanted to know if anyone had any insight into the Katie Beckett waiver.
I'm sure I could find somebody. Absolutely. I can, I don't have a pen. If someone could write down their contact information, if you want to put it in the chat, I could definitely do some more research and find somebody for them.
Okay, thank you. I think we got one in chat too. And then it says, what is expected as an independent provider is one of the questions, which we kind of went over a little bit.
Yeah, a little bit. It's just that you provide services. We do have a policy manual on our website in the resources tab on our website that kind of goes over all of our services and what's required in those services. So just that you follow, whatever service that you're providing, it does have limitations for that service. Some of our services are only allowed to be billed for 70 hours a week. Our day services are only 35 hours a week. So it just kind of goes through just limitations on the different services and what you can and can't do during those.
Okay. And then last question I have here is, what are the documentation requirements as an independent provider?
So on the DD waiver, because it is habilitative, we do require that habilitation program to be done before you can bill for services. So just documenting the data when you're working with that participant is what's required on that service. The AD side of things, they're not habilitative, they're more maintaining and more like a medical model type of thing. So we don't require them to have that program.
I was wondering if you could provide us maybe an update on how EVV is going. I know in the beginning there was quite a few bumps in the road, and maybe some people who weren't quite as comfortable with technology were having some issues. So have you guys seen those kind of resolve, and what kind of feedback are you getting?
Yeah, I still think we have seen them resolve, yes. And then for the ones who aren't as comfortable, they can get it's like an EVV little thing, so they don't have to deal with their smartphone or something like that, and they can clock in and clock out on that device. We do, I mean, some weeks are rougher than others for people, and just it's basically the same things kind of coming up when they do call me and I walk them through. It's the same kind of issues. So we're actually working on some more training, or updated training, I should say, for people about that EVV. But I think it's getting better. I mean, it seems to be.
We had a few more questions come in. So if you are a specific person's DSP, can you sometimes do respite and sometimes community inclusion?
Yes, if
Okay.
you do, so on your referral form, they have services that you're willing to provide, and that's on the second page that service coordinator fills out. So if you are approved to do respite and you're also approved to do community integration, yes, you can do both.
Okay. And then can you give an example of a habilitative program goal, what we were talking about earlier?
Sure. So they can range anywhere. I mean, we have ones like if you're going out into the community with somebody, you could do a goal as socialization, saying hello to somebody. If you're going to a restaurant, ordering their food, or, just having those general interactions with the community and people around them. There have been programs to do cleaning, of the house. If you're doing a residential program, they could walk them through how to vacuum, how to dust. I mean, you can basically program anything. If the participant has those skills, everybody gets an assessment done that kind of tells them maybe where the skills that they need to work on with them, or that they need to improve on.
Okay. And is that kind of where this kind of flows into this question then? Are the services that are billed between 70 and 35 hours a week a state requirement or a federal requirement?
State.
Okay.
They're in our waivers, sorry, not our regulations, in our waivers.
And then someone wanted to know, when your map is done, when and where will they be able to access the map that's just going to show the independent provider list?
That will be on our main website. we haven't quite exactly worked out where we're gonna put it. It may be on our resources page, it may be right there on our front page. I would kind of like it to be right on our front page, but we haven't exactly worked out where it's gonna fit yet.
Okay, thank you.
So I had a question come in. If somebody is applying to be an independent service provider and they're having difficulties with the application process, whether it's getting their CPR or whatever it might be, who do they contact if they don't have a specific individual in mind to be their provider to contact their services coordinator? Who would they contact to help with that enrollment process?
They can either contact me or Maximus directly as well. There's a lot of things that I can definitely help them walk through it and stuff like that, that Maximus can also help with, but sometimes it's just easier. I'm one person sitting at my desk instead of like in a call center for Maximus. So it's fine if they do contact me and I can help them walk through that. And sometimes I can even get into their account if they give me their password and stuff, if they feel comfortable with that. And I'm able to, like, you know, I've had this come up. I can't submit it. I don't know what I'm doing wrong. And they're just at the end of their rope. If they can't upload documents into Maximus, I have no problem with them sending them to me, and then I can go into their account and upload them for them. If they have technical issues, or, you know, maybe their Wi-Fi isn't the greatest, or they can't figure out how to do it. So I would say me. I would be the main contact for that.
And then how are the services decided for independent providers versus agency providers?
Like, how are they decided just in general?
How are they decided? I'm guessing reimbursement would be my guess what that is.
They've, I know us as a state have done like rate studies and different stuff like that. I do know we look at other states. We do research on what other states pay their DSPs or their independent providers, as well as like agency studies. All agency providers have to turn in cost reports to us quarterly. So we kind of look at that when we put together our studies.
Just to follow up to that last question, then it may be that are the services provided by the provider, like the program, anything like that, do they differ between having an independent service provider provided or having an organization or a business provided?
Nope. It is the same requirements. They all have to have habilitation programs and do that habilitation on the DD waiver.
Okay, and the participant leads those services?
Yes.
What they will be?
Yes. And we have just, the state has just collaborated with the Charting the Life course system. So we're really pushing and training our service coordinators. We just got done doing person-centered planning with Mark Friedman. So we are piggybacking on that and now using some of the tools from the Charting the Life course system. Myself and then Colin, who's one of our project managers, are going to go around and do kind of either in person or WebEx. We do give the choice of both. Just kind of explaining, introducing Charting the Life course. I know we've had a kind of a kickoff for Charting the Life course, but this is really going to help us get to that point where it's going to be very participant driven, and just the participant drives our services.
So we've heard some feedback about sometimes it's hard to get an independent service provider just because so much of the onus of responsibility is on them, whether it be getting all the paperwork and enrollment and you know, rather than going through an organization. So do you have any like tricks of the trade or any words of wisdom maybe that you could help either the independent service providers or individuals who need them to make it a little bit easier to obtain those services?
I know it is. I have I've gotten the same feedback that it's definitely hard to, it seems burdensome, and it has a lot of potholes to become a provider. And then when you become a provider, it is burdensome to bill sometimes when you don't know exactly what you're doing. As far as tips, I try to make sure and send out an email that kind of lays out the link and then the attachment for them to try to walk through. I know Maximus on their website does have training, which I also include that link in there. It includes screenshots of exactly how to walk through the whole referral process, and then what to put in each section and stuff like that. As far as tricks of the trade, I mean, that might be I'm not, and then, like I said, contact me if you have any troubles, or Maximus as well. They are there to help. I'm not really sure what other tricks of the trade. It's kind of, at this point, unfortunately, kind of is what it is. And we try to just assist as possible when things come up.
Just another question on being the independent service provider. If they are an ISP and they happen to get hurt while taking care of the individual, is there any, who would be responsible for that?
So that's a good question. I've never been asked that one before. I would have to get back to that person. I don't want to say something that I'm not really comfortable with. I mean, my first instinct would be, that they're contracted with the state. So it would be, they wouldn't have that, employment, what's it called? Sorry, I'm trying to think of what, but yeah, let me, if you could just send me whoever wrote that, I'll do a little bit more research and get back to them on that.
Okay, thank you. Do we have any other questions before we close the question and answer?
These are good questions, keeping me on my toes.
Again, with the shortage, do you think, is the state looking at anything to kind of help address incentives or help alleviate the burden of having providers? Do you know?
I do know they are looking into some things. We were given some money with the coronavirus stuff. And so from January to July, the independent providers are going to get a 15% increase from January of this year to July. And then after that, I do believe that the legislation just passed an increase. I don't exactly know how much that is for sure. But yes, we are looking at different things. As I know, the legislation is also obviously looking at those as well.
It looks like that's all we have for questions. Thank you so much, Shauna, for being here and presenting and giving us all this information. We appreciate it. And even more so for the offer of, if we have any questions, if anybody needs anything related to this, you can obviously reach out to Whitney or I or Shauna. I can send out a follow-up email that will have our email addresses. I believe I sent out the slides, so if anybody didn't get them, if they wouldn't mind contacting me, and I can get those to you also. But if anybody needs anything additional, again, just reach out and we would be happy to get that.